Hi guys, Devon here again from Absolute Injury Management, Gippsland's Exercise and Sports Medicine Centre, and today's video is all about acute ankle injuries and how we can prevent them. Now, why do we need to prevent them? They are the number one injury that occur in sport. About 14% of all sporting injuries are acute ankle injuries. Now, if we talk about ankle injuries, we're talking about injuries to the outside of the ankle specifically in this video because they're 4 times more likely to occur than injuries to the ligaments on the inside. So they're the ones we're talking about in today's video. Now, if you have one of those lateral ligament injuries, you're definitely going to get some pain, you're definitely going to get some swelling, you might even get some bruising, and if we don't rehab these injuries correctly, then our whole lower limb is affected. We have ongoing pain and stiffness, we get some changes in the lower limb, and we can end up with things like shin pain, kneecap pain, muscle injuries, hip pain, for example, all because we've failed to rehab correctly. Now, the number one concept you need to understand when it comes to preventing ankle injuries or why they occur is the word proprioception. Now, proprioception is basically communication between our brain and our ankle, and our brain basically needs to be aware of what position our ankle is in, and that's what proprioception is. So our brain needs to register information that's coming from our ankle and decipher what its position is and whether it needs to do anything about correcting it. So if we talk about the 3 tips that we can give you in terms of preventing these acute ankle injuries, number 1 is if you have an ankle injury or you've had an ankle injury, you need to make sure you rehab it correctly. Just like I said, if we fail to do that, we're going to get a multitude of contributing factors in that lower limb, which may then cause other injuries. So if you've had one or you've got one, you need to rehab it right, because you need to get that proprioception message to be retrained. As soon as we have an injury, that message actually gets delayed, and therefore you're more vulnerable to that happening again. So you might have heard the phrase once an ankle sprainer, always an ankle sprainer. It's exactly why. So once we've had one, the message gets affected, and therefore we're vulnerable to that happening again. So we need to retrain that message. You'll see people talking about doing things on wobble boards or closing their eyes and doing some balance work. They're just training proprioception so that the message can, and then the communication between the brain and the ankle can happen much faster. So it will stop us then from rolling again. So that's certainly our first tip. If you've got an injury or you've had an injury, you need to rehab it correctly. Number 2 is that we should be doing some things in our training program as a preventative measure. So we might not have had an ankle injury in the past, but coaches out there, we should have some form of training or retraining for ankle proprioception in our programs to stop these injuries from happening, especially in court sports and any football codes. They're the ones that are most commonly associated with these ankle injuries. So we should be doing some, it doesn't have to be a lot, but there just needs to be some form of retraining in the program to help train this message to occur on a very prompt, fast basis between the brain and the ankle. So this proprioception is very sharp. Number 3 is around taping and bracing. So especially in court sports and football codes, like I said, taping and bracing is just a way of helping to prevent and support the brain communication with the ankle. So a lot of people think that by taping and bracing, all we're doing is giving the joint structural support so that if we're going to roll it, it's going to stop it. Sure, it does a little bit of that, but to a lesser extent. The most important thing that it does is that it actually helps facilitate that message between the brain and the ankle. The faster that message occurs, the better. So when we go to roll and we've got tape on our ankle, for example, it actually tugs on the skin, and because it's tugging on the skin, the brain gets a message to say, hang on a minute, something's happening on down there in the ankle, I need to correct it. So that's probably the biggest component or the biggest facilitation we get from bracing and taping. Now, we're here to help you with all that stuff. So if you've got an ankle sprain, you've had an ankle sprain and you need to get that rehabbed, then by all means come to us. If you're looking for some information, you could be a coach, you could be someone who's just wants to prevent an ankle injury, then sure, come and see us. We can set you up with a preventative proprioception retraining program. Or if you're after any advice when it comes to taping and bracing, we're the guys to speak to here as well. So jump online at absoluteim.com.au or give us a call on 51747250, and we can help make sure you don't suffer an ankle injury this season and keep yourself out on the park. Thanks, guys.